stem cell mixed with a fat injection over and around the eyes. See here. He looks fine. Better. Getting better every day. And also here you can see the incision, because we did the facelift and the neck lift also. This pictures about the 3 months depression here and after here. And quality is very nice. So his skin is, quality is getting better now. And what we have to do, in the future is going to be, everybody say, oh, you don't do facelift. Everybody say the plastic surgery we don't need anymore and we can do fat injection. Of course not, because this patient, about 70 years old, and only fat injection, even mixed with the stem cell, doesn't help her. We have to do facelift. But I can tell if we did a stem cell early age, before the age of starting aging process, we can say you don't need a facelift. But after aging, we have to do some other problem, facelift, blepharoplasty, and neck lift, and together maybe stem cell injection can help for achieve the best result. Here, you see the aging process, sagging, tear-through deformity, decrease the fullness, and almost 3 lines here. That's why we saw her ugly and looks tired. And here, nice, see? And I think I told her she needs a neck lift also, but she doesn't want it. And see here, still here, she has a problem, but almost, I can tell, 20 years, looks younger, and other sides also. I'm doing some of the patient reconstructive stem cell injection. This patient, I think, is 19 years old, and he has an accident. Very big defect here and here also. You can see the here about the 3 centimeters tissue defect. What we can do with him, and we did flap, synthetic skin graft, and stem cell injection with the fat, because the graft and mucosal flap is good, but still he has a big problem in this area, and I want to make some volume here, and he's looks fine. Also, I used for this patient, but I didn't do fat here, only stem cell and replantation. This is, I think, is about 3 weeks after, and also this is. And the end of the 1 year, he started to use his finger. Of course, the nerve rejuvenation is very important, and I believe that stem cell can help for this rejuvenation. And this is one of the cases, diabetic one, only stem cell without fat. And I have a couple cases, I mix it with the fat stem cell, but I don't like it because the starting infection, and I stopped to use fat with the stem cell anymore. I'm not doing. I think it's the best things is that you can do only stem cell directly injected around the wound. But we need a more case, I think I have to say. This patient has I think grandmother's mom and grandmom has breast cancer. She was afraid to be cancer in the future also. And she came to me she wants to do prophylactic mastectomy. Also doctor says she had a big risk because she both breast has a loss of fibrocystic, and she need to do all the time MRI and ultrasound. She was tired. She said, just take my breast. And she had mastectomy and reconstruction with the silicone implant. And when after the mastectomy, when you use the directly silicone implant, it looks not fine because there is no fat and you can feel this implant. That's why I use the lots of fat mixed with stem cell. She was 55 years old, and her sister came to me. She was 20 years old. She said she wanted the same surgery because the result was very good for her. What is the truth behind the stem cell cosmetic surgery? Stem cells are definitely the future of medicine and plastic surgery. But the truth is, stem cell therapy in aesthetic and reconstructive surgery should be conducted with clinical study under institutional review board approval, including compliance with all guidelines. It is important for physicians to follow best clinical practice, particularly in the area of patient assessment and selection. And also, the main thing is, if patient is happy, if patient is smiling, whenever which technique is used, it doesn't matter. But we have to do all the time what patient needed and how I can help him. Thank you.
Şimdi Dr. Klenze is one of the unique anti-aging doctors, preventive medicine doctors who founded the European and American societies. And yesterday we had a very excellent speech from him. And today he will present us some of his patients, which they apply in his Thailand center for anti-aging and cosmetic and stem cell indications.
Good afternoon. Thank you very much, Nesreen, for presenting me very nicely. Yes, I was a little surprised because Nesreen asked me to show some cases. Actually, I had my computer here, but my main computer is in Thailand, in Phuket, so I tried to find something which is not only from me. I will say in advance, it's from a group which I work with, and different cells, but all together they are mesenchymal stem cell treatments, and mesenchymal stem cells which were defined, that were cultivated and defined, and a little different to that what we saw today. The outcome result does not so much depend on this. I saw very good results today in the morning from, especially from you and from your guys, and very interesting with the treatment of the fistulas. So the outcome actually is not so much. So what we're using mostly are two different cell groups. One is the typical mesenchymal stem cells, which we found from bone marrow aspiration. The other group is a special group which I'm more focused on in the last years, is a special subunit of a cell group which is called ABCB5 cells. These are mesenchymal stem cells which have a pluripotency like embryonic cells, but they are not embryonic cells and they are not iPS cells. So they have a special niche in the skin and they can be detected. This is already done by a group in Heidelberg. They work together with Harvard, so they have the common patent of these kind of cells. But I want to show you a little, and I want to show what you know, not how wonderful we are, but how much difficulties we are confronted with when we use it right now. This is a very nice work. I just started with this, renovating the heart. You can see that you can use especially stem cells for the renovation of the heart. That means especially after myocardial infarction, when you have the patient has a reduced ejection fraction because of the muscle, the piece of the muscle which is not very much circulated, is at least apoptotic and necrotic, and does not take part in the pump function. So what we, until this time, did was just we tried to prevent the patient from the relapse of the second myocardial infarction. But what we're doing today is more. So I will show you. This is, for example, a rat cell. You see there is one non-treated area, post and anterior ventricle of the heart. You see this is treated with mesenchymal stem cells, and you see that is actually less scar formation, and the muscle is much more better formated. So that comes to the idea that it's a heart repairing itself, and this is an interesting picture. I like this very much because this shows you this is a heart of a remnant of a male recipient, a male recipient, the bone marrow of the male, and the heart is from a female donor. So it's very interesting. You expect this heart to be female, but after a while they could get evidence that the heart changes its sex. So it became a Y chromosome fluorescent labeling in the nucleus, the cardiomyocytes, so the heart became male by its own. So there's probably a big thing working on in our body, which has a high self-repair and high self-situation as well. And this leads to the question, when we're talking about stem cell treatment, in anti-aging medicine, what's probably a very important part is because it's preventive and regenerative medicine of aging population. And if we talk about this, then we have the question, if we treat by IV, when we treat defined cells with IV shots, so what is the effect in the brain? Is it an effect? Is the cells, can they pass the blood-brain barrier? Apparently not. So what happens in the brain? So there seems to be in the brain as well as the heart, where we have, our niches of our own stem cells, which is probably by the stem cells we use, they produce growth factors, and these growth factors are stimulating cells to grow in the periphery, far away from the location where you inject. So it's apparently not necessary always to inject in that area where you think you have the damage. The stem cells need a part of inflammation to know where to go, and when you give them IV, they go exactly to that place, or they send out their signaling cytokines and growth factors. So mesenchymal stem cell, as you know, they can bone marrow derived, they can fat adipose tissue derived cells. The easier way is a fat tissue. We use long time apheresis. That means we isolated them from the blood, and then with cytoflowmetry could then give evidence which kind of cells it is, CD34 progenitor cells and or heart progenitor cells, and then we can see that the mesenchymal stem cells are different to this, and we try to get this as well now from fat, especially for small treatments like cartilage treatment. As you probably know, I'm working in a big sports center, and the athletes have that problem. So this is a malicious problem, delicious and malicious problem, where that means at the end of the day, this good food can cause this narrowing of the coronary, that we call coronary artery disease, which is involved in a lot of inflammation and factors, adhesion factors, which create the so-called plaques. And the plaques narrow in, they're sometimes calcified, sometimes not calcified. They're non-calcified, we call them stable. So what happens at the end of the day, we are trying to, with the traditional solutions, which we use statin drugs, blood thinning, aspirin, beta blockers, mostly not in the preventive part, but ACE inhibitors to reduce the pressure on the heart in case of hypertension. Angioplasties can be more and stents. So these solutions are fine, but in the moment you have this part of the heart which is actually destroyed, this muscle part, then you need more than to just do the stent, because with the stent or with the bypass you cannot change this area. So that's why this is a work from Brehm in Düsseldorf, who was at the time at Düsseldorf, and just published it in its anti-aging journal. And that's very important, that the causal therapy, at the end is only to replace the loss of the bilateral myocardium, and thereby to avoid remodeling and heart failure for the later ages. And doing both in one is very interesting. Doing on one side the stent into the heart coronaries, on the other side with the same catheter inject into the muscles the mesenchymal stem cells, which we then have. They can even use a combination. If you have bone marrow derived stem cells, you have a lot of hematopoietic stem cells as well, and then you use both of them, and then you got a new myocardium formation here, which shows here the growth of the wall is coming up then after 1 month with a repair of 38% of the tissue damage. Some cases I spent time in India, Bangalore, in a company called Therapeutics to learn about this mesenchymal stem cell treatments and mesenchymal stem cell cultivation. So I went there, and Therapeutics belongs to a big foundation there in Bangalore, and they had very nicely done what I did then as well. This is a photo of my friend here. Done cases of leg ischemia. Leg ischemia, as you know, is something which have diabetic people, and you find it as well in the case of smokers. And normally we call this claudicatio. The claudicatio, that means they can't walk anymore really, they stand and walk 10 meters and they have to stand. And in the worst case, you find even the feet like this, you know, there's hardly no circulation anymore. And giving this into directly, as you saw before, into the arteria femoralis, these two cells, then you get this improvement. March 14, July 13, 2008, a huge improvement. And as well with the wound healing situation, in these cases, the cells, when you give it directly, not on the wound, we did not give it on the wound, we put it into the arteria femoralis, and then you find the healing. And here, this is a nice picture to see the poorness of the vasculation here, and then you see the enriched new building on formation of new vessels in leg ischemia. So there are some cases in that scale. What we'll do, we had found a number of patients, and number of patients treated were 4, and improvement was 4 as well, and 2 others coming later were as well improved. This is a very good rate in this leg ischemia. Leg ischemia is an extremely good response to stem cell treatment with easy MSC cells. Coronal spine injury as well. This is a study here with they had 34 patient case studies. Improved were 10 after 18 months, and it was very dramatic to see. You see people who are completely paralyzed after the spinal injury. This experience was very interesting to see. The first time, we just injected it around the spinal canal, but it did not work very well. You have really to find the point where the damage was, and not to wait too long. If you wait too long with a big scar, you don't have any chance. So it's good to go in the first 4 weeks or 8 weeks after spinal injury, go directly. One of this patient was a director of the Universal Studios in Hollywood, and he had a ski accident. It was a big injury, spinal injury, and he was first in the US, and they did not, as you probably can imagine, a sensor treatment with him. So he went then out, came to this clinic, and then they injected them, and he could walk again. So what here is a picture from the Indian Bangalore clinic, and you see what is first dramatically is the bladder movement restored and the bowel movement restored. That's extremely good because these people, when you imagine what kind of suffering this is to have this, even they cannot walk, they have this restoration of this movement. It's extremely dramatic. And then they find the sensation bosoms, and after a time they could even walk with about 1 month to 6 weeks until 2, 3, 4 months as well. They can walk with caliper. This has to be repeated. You give 20 million cells about, and then it has to be repeated after 1 month again, and once again. So 3, 4 repeats we did in these patients. Very dramatic to see, and I was more surprised to see this in India. But in India they have less legal problems, so they are very fast in development of this thing, not so restriction like we have. So now we come to a very interesting part of cells called ABCD5 cells. I've already announced this before. These cells have been found and have been identified. They are progenitor cells, dermal progenitor cells, and this actually mesenchymal stem cells. And we harvest them from the skin biopsy, and then when they are harvested, they are then cultivated. And this is only possible in some laboratories here in Germany, because they have this in some states of Germany. They have the allowance permissions to do this, and there's a GMP lab which has to show up very well that it's working good. And the thing is, what you function of the cells is going down up there. So we have really to find out what is it at the end of the day when we talk about a 60, 70 or 80-year-old man to take stem cells out of him, how much of stem cells are there and are they still good? Are they still good in quality? Are they still producing? Is the behavior of the cells different from that, what we know or not? There are a lot of questions to do. This was a female, birth date 1976. She was with type 1 diabetes, and in this type 1 diabetes you're very easily confronted with one very important problem in this stem cell treatment. That is the autoimmunity of this disease. The autoimmunity of this disease actually makes it very hard to get through with stem cell treatment. Because you get this, you improve the patients, and after a while they're coming back with the old stuff. So the insulin, which is going up in the production, C-peptide is increased. So you have a very good situation of new Langerhans function cells, and then after a while it goes down again. So that's a big problem of the autologous stem cell application. What we did, I show you that it's done in the pancreatic artery. This is a lady. She was diagnosed at the age of 12, controlled till 2003 with insulin injection, to blindness caused by diabetic retinopathy, proliferative retinopathy. She had a renal deficiency, diabetic nephropathy, dialysis, and insulin lantus were given for meals. So the decision for stem cell therapy with autologous mesenchymal stem cells, ABCB5 cells, was done, and then it was done by selective angiography with the pancreatic artery with a group of my friends here, Paul Columbus, and so on in Athens. And you saw that the management plan was that we knew exactly that we have to do more than one injection from the beginning. The urea was already, high, creatinine very high, insulin was low, expectable low, C-peptide very low as well, expectable very low. So you see that the pancreatic artery, and you have to get into this artery with a catheter coming in and then inject directly into the pancreas tissue. You see here, right, in the pancreas tissue, and then you get the cells done. Here another pictures of this, here the catheter. And that's a very, very, very good, well done situation, but as I told you, it's not diabetes type 2, it's diabetes type 1 with autoimmunity. So this, the case before normal was urea 100, and this was the first. Then it improved, the urea improved, the creatinine went down, the nephropathy improved, the insulin production increased as well. And after a long time, then we found, unfortunately, not so much. CPAP people was good as well, in insulin, but after a long time, she went back to the old situation. But it nearly was over 1 year, good improvement, but she has to do another treatment and another treatment. Another case of this group was a multiple sclerosis group. A patient, a man with 49 years, Parkinson's, thyroiditis, the father, mother diabetes, uterus carcinoma, personal history, rheumatic fever, treated 10 years with penicillin. Probably this was the origin of this secondary disease, multiple sclerosis. So there was fever, hypoesthesia, at the 5 level difficulty of walking. He recovered completely after 1 year. No MRI, no lumbar puncture. 12 years free of symptoms. 1998, the MS was diagnosed. 2000, treatment began globally, interferon, relapses, different therapies, mitochondrial syndrome globally, and so on. 2007, spastic, ataxic, paralysis, finally neurogenic bladder. Then 2007-09, he passed from relapsing, remitting form and converted to secondary progression, decision to try stem cells. They did the MRI tractography, a very elegant method to see the spinal tract to see if there's a damage in the spinal tract. Here again, you see that, and on the other side here, very thin. And the management plan was first administration on July 2nd,